Hello, I'm Bernie Rubin. I'm the Chief of Rheumatology at Henry Ford Hospital, and I'm here in beautiful Maui at RWCS 2018. We have several fellows who have presented cases and abstracts, and I'm here to discuss this case with Jeff Chwa, who is a fellow at Scripps, and he and I are going to talk about his case. Jeff, I see you have a case here of granulomatosis with polyangiitis. I mean, a lot of us in practice have seen GPA. Tell me a few things about your case that makes it unusual.
Yeah, so aloha. So large case, but small poster. This was a 22-year-old younger patient that we saw in the hospital for consultation. Coming in with pretty straightforward, seemed like a GPA case, had upper respiratory symptoms, came in with alveolar hemorrhage, had a pretty thorough workup and had the CA ANCA positivity, PR3 positive, so it seemed pretty straightforward, everything was done, and we were consulted.
So what was unusual about the case?
So, patient was, I guess the unusual part of it was, he was found to have bilateral lower extremity DVTs, which, okay, and he had an IVC filter placed for that, but and he was treated with pulse steroids and rituximab and was doing fine, and on his way out, on the last day, he came in, or he was found to have a painful left foot. It was cyanotic, it was cool, and that kind of threw us off a little bit.
What did it turn out to be?
So it turned out to be bilateral arterial clots as well for him.
So you think that he had evidence of both arterial and venous disease as related to his GPA?
Exactly, and that kind of caught us obviously off guard, and just given his history of the alveolar hemorrhage, it made it very difficult clinically to kind of figure out what the next step would be.
And what was the next step?
So we kind of went back and forth in terms of what to do. It's going to be difficult to anticoagulate him, to treat the clots with his hemorrhage. So we had vascular come by, and unfortunately he ended up having bilateral amputations of his lower extremities. But
oh wow, well that's a terrible outcome. But I think, do you think that this might be something that we have to look at more often in our people with GPA?
No, definitely. I think it's something that definitely caught us kind of off guard, and something new that the faculty at Scripps we've never seen this before. So just kind of something you take away from fellowship and definitely into your career. Yeah, something that.
Well, thank you very much. That's a very interesting and certainly a very morbid outcome for somebody with GPA. So I think all of us that take care of these patients will have to be aware of this kind of a problem in the future. Thanks again. That was a great case.
Thank you. Thank you so much.